Reading 18. Fighting the Flu. Most of us get the flu about once a year during the winter or flu season, as it is also known. We get a fever, a sore throat, and we might develop a cough. Our bodies do not feel right, and we feel so tired that it is difficult to get out of bed. We feel pretty bad for a few days, and then we get over it. There is no real cure for the flu other than getting lots of rest and drinking lots of water and fruit juices. You can take medicine to help your symptoms, but these medicines do not actually fight the virus. They can bring down your temperature or make you stop coughing, for example, but they do not kill the flu virus. There are some medicines that doctors can give people with serious flu symptoms. Of course, it is better to try to prevent an illness than to try to cure it. There is a vaccine that can prevent a person from getting the flu. Young children and old people should get this vaccine. However, the flu virus changes from year to year. This makes it difficult to make a vaccine. A flu vaccine that worked last year might not work this year because there is a new type of flu going around. So the flu vaccine needs to be updated every year. And the World Health Organization does just that. The WHO has centers all over the world where researchers study the new flu viruses, share their findings, and work together to come up with a new vaccine each year. There are two forms of the flu vaccine. One is a shot of the dead virus, where the virus in the vaccine has been treated so that it cannot make copies of itself. Since it cannot spread or get stronger, it is basically dead. The other type is a vaccine that goes up the nose. In other words, it is breathed into the body instead of shot into the blood. It is a live virus, so it can still make copies of itself, but it has been treated to make it easier for the body to fight. It seems that the live virus is actually more effective than the shot of the dead virus. The increased use of both types of vaccines has greatly decreased the numbers of deaths resulting from the flu virus each year.